As of the report that we released earlier this afternoon, as you probably saw, provided an update of where things have been over the last several weeks in the county. We are starting to see some stabilization in the number of our trends that had been rapidly or exponentially increasing. Over the last 2 weeks, we have seen sort of a slight decline in our average daily case counts. They are still very elevated, though. Just in the last 2 weeks, it's been about 536 cases per day. Our percent positivity, of course, which is a great indication of the level of transmission in our community, remains very high or elevated. It's at about 13.1%. And as I'm sure many of you heard yesterday, our hospitals continue to be strained as a result of the high number of COVID-19 patients they have in their facilities. Here locally in Mecklenburg County, we're averaging roughly 450 patients with COVID-19 in our hospitals here and just the facilities that are in the county here. As you probably also heard, we're continuing to see that the majority of those folks who are in the hospital have not yet been vaccinated. And many of those individuals are younger adults and much younger than they had been compared to earlier surges we've had in the pandemic. And so as you'll probably hear several times throughout this conference, we continue to encourage everyone to get vaccinated to avoid these severe complications of this virus. Unfortunately, we're also seeing a rising number of deaths in our community, which typically lags following periods of high transmission. We have seen roughly a tenfold increase in deaths since June of this year. And this past June, we had approximately 6 deaths during the entire month of June. In July, we had 18 deaths. In August, we had 65. So as you can see, we are starting to see more routine, more frequent reported deaths due to COVID-19. And unfortunately, many of these folks are younger than individuals that have died in previous waves of the surge in Mecklenburg County. Less than 20% of all the deaths that we've seen since the beginning of the pandemic have been among younger adults. Over the last month, however, more than 40% of the deaths have been among adults who are 20 to 59 years old. In just the last few weeks, we've unfortunately lost 4 individuals who are really young adults between the ages of 20 to 39, with the youngest of those being 23. And while some of those individuals did have underlying health conditions, they didn't all have underlying health conditions, but the common risk factor, particularly in the young folks, is that they weren't yet vaccinated. And so we continue to see the impact of folks not being vaccinated in our community, but we're also seeing the impact of people being vaccinated. So if we look at our long-term care facilities, we're starting to see a rapid increase in the number of outbreaks in those facilities. Thankfully, most of those outbreaks have been largely contained to very few cases. And those cases are most commonly amongst staff members who are not residents of the facility, but who leave and come and go on a daily basis. Fortunately for us in Mecklenburg, most of our residents at these facilities are fully vaccinated. And thus, we're not really seeing the large size of outbreaks that we saw previously in the pandemic, nor are we seeing the high number of deaths that we saw among our most vulnerable adults living in these facilities. Among the 69 deaths that we've had in the last month, only one of those deaths was among a resident of long-term care facilities. That's starkly different than from sort of pre-vaccination days last fall, where the majority of our deaths were coming from residents of these facilities. So I think that's just more and more evidence that the vaccines work. They are working. We've got to make sure everybody in our community knows that the data is really overwhelming, and vaccines are one of the most important things we can all do at this point to protect ourselves and our family members and loved ones from the impacts of this virus. Unfortunately, just this morning, we did receive our first report of a death among a staff member at a long-term care facility here in Mecklenburg County. Since the pandemic has begun, we had not had one of those previously. And so we will continue to reemphasize the importance of, again, everybody getting vaccinated, especially those who work in really high-risk settings or in healthcare settings. On a positive side, we are seeing some slow uptick in vaccination rates in Mecklenburg County. We've been seeing that for the last several weeks, which is certainly encouraging. As of this morning, 57% of our residents have received at least 1 dose, and 53% are fully vaccinated. So now I'm going to pass it back to Gibby to just talk a little bit more about some of the data and sort of where we are and preparations for this weekend.
Thank you, Renard. I want to just make a few points, and then we'll be happy to open up for questions. If you listen to the data, we're at a bit of a tipping point in our community. We could go either way. our numbers could continue to climb. We could continue to see high numbers of deaths, and we could continue to see challenges with our hospitals. Or we could see the top of the surge that we've been seeing with some downward trends. But the one thing that I want to point out is that our situation moving into Labor Day is very different than it was last year. Last year, we were experiencing low to moderate community transmission. We've been saying over the last month and a half that we are in the red with significant transmission in our community. Last year, our case counts and our number of cases was relatively low, and our positivity rate was around 5 to 6% as compared to the 13% we're seeing right now. Our hospitals, we're seeing about 150 cases in the hospital per day. And as Reynard mentioned, we are seeing 450 a day now. So our hospitals are more strained as we move into the holiday as well. We were also under an executive order, and our children were not going back to school. They were going to be virtual through the fall, which is very different than what we're seeing this year, where the majority of students are back in the classroom. And the other variable that we have this year that we did not have last year is the Delta variant. And we've talked significantly about how transmissible this particular variant is and how quickly it's moving through our community, even through those who are vaccinated. And as we've said before, even if you're vaccinated, if you become infected, you can transmit this virus. So you put all of those things together, and moving into a holiday weekend where we know that there's going to be lots of activity, people are going to be gathering, it's more and more and more important for us to do the things that we know are going to help prevent the spread of this virus. We've always talked about the 3 W's. Those are still in place. Those are things we need to be careful and make sure that we're implementing. People need to get vaccinated. We say that over and over and over again, but all of the data and everything we're seeing in our hospitals, you saw that the large majority of the individuals who are in the hospital or who are on some sort of life support, ventilators in the ICUs, are unvaccinated. We know that vaccinated people are becoming infected, but they're not ending up in the hospital in these significant situations. So again, emphasis, emphasis, emphasis on the vaccine. We've talked over the last number of months as well about some of our priorities. One is our hospitals cannot sustain an ongoing surge from COVID. There are other things that they're needing to deal with. People have other illnesses. We're moving into the winter months when there's going to be increased other viruses in addition to COVID. So we've got to protect our hospital capacity, and we need our children to stay in school. We've gotten them back in school, but that's not going to do us any good. You've heard around us in other counties some issues here. If you looked at our data today, you'll see that we're seeing clusters and outbreaks in some of our school settings. We need our children to stay in school. So all of those things are going to require us to do the things that we know make a difference. Vaccination, number 1, and masking, number 2. You're aware that the mask mandate for the entire county went into effect earlier this week. Every municipality, the city of Charlotte, the unincorporated areas, all of them are under a mask mandate now in Mecklenburg County for indoor settings. And that includes all indoor settings unless you're in your home. So anytime you go out of your house and into any type of facility, school, wherever, you should be wearing a mask. There are a few exceptions, but we really need people to think critically about whether they need those exceptions. There are some who do, but please be truthful about that and wear a mask. It's a simple thing to do, and we're not asking you to do it forever. We just need you to do it now. So as we move into the holiday weekend, avoid large crowds if you can, definitely indoors, but even outdoors. If you're outdoors and you're around people that you don't know, wear a mask. You need to be wearing a mask in settings where you're around a lot of people, and just be very conscious of your surroundings and be as safe as you possibly can.